With every breath, a promise to rise. Together we chase the limitless skies. Galvanize the world, feel the mold of my life. Every healthy choice, it feels so right. Data in our hands, we hold the key. A future built on trust and integrity. Galvanize the world, feel the light. With every healthy choice, it feels so right. Data in our hands, we hold the key. A future built on trust and integrity.
Well, hello, Galvanators, and welcome to June. Here we are, another month. I cannot believe it. Thank you for tuning in today, wherever you're tuning in from. It's always great to have you on these calls participating, and we love to see your comments. And more than anything, just to get this information out to you, to your community members, and be able to just give you updates on what's going on with Galvan, what's going on with just this industry as a whole, which is awesome to see all the changes that have already transpired this year, that are putting things and lining things up for us to be able to win and just help more and more people win. And that's what it's all about. You know, I was talking to a gentleman last night, pretty successful in athlete and in business. And one of the things that we were talking about, how isn't it amazing that when you are adding value to somebody's life, you know, when you're out there and you're a giver instead of a taker, when you're trying to make somebody better, leave somebody in a better situation than otherwise, success just can chase you down. It tracks you down. And all the other aspects of success that we think of, you know, financially and all those other things, are byproducts when you're just going out there and you're trying to change the world for the better, for the right reasons. And I love that that's the type of people that we attract here at Galvan. Those are the people that are the Galvanators that are out there. You're here because you see something that is bigger than you. And you see that we are on the edge of changing so many people's lives with empowerment in a way that only blockchain can. And so love the fact that we're on this mission together. Love the fact that we have a chance that when we leave somebody, we can always leave them with a little bit more hope. We can leave them with a little bit more encouragement and help them understand that there are more resources and abilities and options out there than they otherwise thought. I'm going to talk a little bit more about that in the call a little bit later, but let's hop into this. So if you are watching this through any one of our social media channels, you do have an option to also share to your people. And I would just challenge you to do that. Information is so important, but it's going and acting on that information. So as you guys have heard that saying, and you'll hear me say it multiple times, knowledge isn't power. It's the applied knowledge. It's what we do with that makes it powerful. And so the information that you're going to get today is great, but what are we going to go and do with it today, this week, this month? And as we're looking at what's going on here in the month of June, I'm excited for a big month in Galvan and just in what we're doing here. So let's get into this. And we always love to hear from, you know, the CEO of Galvan, Dr. Adam Sharp, who has always got words of wisdom, encouragement, ways and tips that we can become healthier and just understand things a little bit better. So Dr. Sharp, thank you so much for being here. As always, we missed you last week, but we know you were out there doing some good, had some great meetings in Galvan's behalf, and glad to have you back. So I'm going to turn the time over to you. Thank you.
Thank you. Yes, I felt bad to miss last week. I was on a plane, so no way for me to join, but I missed the call and had a great time with a variety of blockchain masters and leaders last week. That was exciting, and also it's always exhilarating to see how what we are doing is really one of, in my opinion, the best use case of this new technology. And so today, I hope, again, I don't want this to be a downer, but I just want to highlight some of the very specific examples about why there needs to be a change and a revolution to improve things in our current health system. And so we're going to talk a little bit about, mostly about some of the current challenges that the health system faces, with very specific examples and references of truth as we know it, at least from the medical science as we can get it. And then we'll end obviously with some blockchain solutions and how G Plus and the mission of Galvan really helps to solve and be a solution to many of these issues. So I start with this. This is Don Berwick. I learned a lot about him. I've met him a few times. He said the following: the healthcare system is not failing because we don't know what to do. So we know what needs to be done. It's failing because we don't do what we know. And that's a problem coming from somebody with a lot of experience over a lot of time in the health system. And it's because the incentives and a variety of things that we'll get into today. But they're just things need to change. And that's from all of the best evidence and the best advocates and experienced health professionals really agree on these topics. So jumping in, let's see. Next slide. Wow. Sorry, guys. I'm going to have to load this back up. For some reason, it only had 2 of my slides. Let me see if I can share my screen here. Sorry about this mix up here. Okay. You, Byron or somebody, can you guys tell me if this is, you see this?
We can see it. Looks good.
Okay, perfect. All right. Sorry for the snafu there. Not sure what happened, but these are the five of the biggest health system problems that we currently are facing. And I'm gonna give you some very specific examples. Sometimes fragmented patient records doesn't mean a whole lot to you. Lack of transparency in costs and outcomes kind of makes sense. Misaligned financial incentives. We'll get into what that actually means for you and I. And then insecure and misused personal health data. And lastly, limited patient empowerment and preventive focus. And so instead of give, somewhat catchphrase terms that don't sometimes hit home, I want to give some very specific examples from the literature about each of these. So starting with fragmented patient records, and I'll give you some personal examples of these. So a few years back, we've known about this for a long time, but less than half of the hospitals were able to find, send, receive, or integrate patient information from outside of their hospital system. Now, not to throw anybody under the bus, I've worked in 4 different states and multiple different health systems. All of them have had problems with this. In fact, once I had a patient that was transferred to our hospital and I saw them in the emergency department. They brought all their health records because they were coming from another facility. And they had a variety of radiology imaging tests that they'd have done. I went and gave it to one of our radiologists and asked them if they would read it. And he unfortunately misunderstood the system. And he said that he was worried that it may be Medicare or Medicaid fraud if he read that test. Now, there is no risk for Medicare or Medicaid fraud to review and document an image that a patient has come in with, unless you try to bill for it more than one time. So bottom line is even within the health professional health system is really less than half the hospitals, based on the data here, is able to use information if it's not done specifically in their facility. Now, maybe the best example, the VA, which is our Veterans Administration for our armed forces and federal employees, and the Department of Defense in the United States spent over $1 billion trying to make their health records compatible. And then they jumped ship. They failed due to siloed systems and lack of interoperability and no longer pursued that. So these are just very real world examples of how fragmented patient records and leaving it up to others, the insurer or the hospital or the health professionals to take care of your records has not been shown to be a good path. The next one, I think most know about this, but the lack of transparency in costs and outcomes. Now, certainly we don't know as consumers or patients about this, but even RAND, which is a big research and development company, has been around for a long time. They showed that employers who sought to receive health services for their employees paid up to 400% more than Medicare for the exact same services. And that's just because nobody really knows what things cost in our current health system in the United States. And this is reflected elsewhere, but this is mostly studies from the US. And so despite CMS, which is 2020, they've required that this is supposed to happen, their hospital transparency rule, they actually looked to see if anybody was following it and found that only 16% of hospitals were actually compliant in publishing the transparency and the standard prices for many of their services and the care that they provide. So bottom line is if the institutions can't, even when required by law, are supposed to create transparency, close to 90% still aren't able to do that. We just don't understand this. And this is not the way that anybody intended it for it to be. Now, the other misaligned financial incentives and how the reward system works within the health system. So they have said that about a third, 30% of the US healthcare spending, which represents over $1 trillion a year, that's a lot of zeros, is considered absolute waste. It's just absolutely not necessary, or it's due to some administrative inefficiency. They've also found that the fee-for-service reimbursement is linked to higher procedure volume, but not better outcomes for patients. Often you may get more procedures or more surgeries. They give an example here that more back surgeries don't necessarily result in fewer patients with back pain-free circumstances and outcomes. So misaligned in financial incentives. We sometimes pay the wrong people in order to get the health outcomes that we want. Insecure and misused personal health data. I don't know if anybody has kept up with some of these things. It can be scary and very unfortunate. But this was a report that over 50 million patient records were breached in 2021. And many of these were from large scale ransomware attacks. So there was a hospital across the street from the hospital that I worked with. They had to send many of their patients over to our hospital because they could not use their health record. And without being able to use their health record because it was held for ransom, they couldn't get the medications that were behind an electronic wall. They couldn't provide care in the way that was needed, purely for people who have gone in and attacked and held for ransom the ability to deliver healthcare. There's another big one that was very common about 6 years ago, the Google's Project Nightingale. A lot of people are like, oh, is this HIPAA compliant? Well, they gained access to 50 million Americans without their patient consent. And this was all done under the HIPAA compliance. This was HIPAA compliant, but not ethically correct. So if you are trusting in someone else to take care of your health information, I think these are a couple really good examples of why you maybe should be wary of that as we move forward. And last, I think anybody and everybody, I think, agrees with this. We don't have a lot of power. We haven't been empowered in the current health system, and there's not a big focus on preventive care to prevent diseases. We have set up a system that treats them once they arrive. Unfortunately, the stats show that 60% of US adults have a chronic disease. 4 out of 10 of those have 2 or more. Most of these are preventable. They could be prevented if we did the right things and made the right choices before they got these diseases. But only 3% of healthcare spending goes towards prevention. And last, if patients are actively involved in their care, if they are informed, if they are the decision makers, if they do that, it has been shown and proven by science that they have better outcomes and they have lower costs. However, the system does little to incentivize self-care. That's just the system that we work in. So all of that, those are some of the issues. Those are some of the problems in the current health system. However, we have new modern technology. We have new hope of ways that we can make this better. And frankly, G+ and all the great things that you hear Robert talking about, that he and our team that have been building G+ are working on, are part of the solution to this systemic problem. So we know that blockchain can store verifiable health records, decentralized and encrypted on a ledger as part of blockchain technology. We know that smart contracts and blockchain ledgers, they can track every financial and medical transaction on the blockchain because everything is tracked on the blockchain. We know that we can reward healthy behaviors. All of you that are participating with G+, you are already getting rewarded for exercise and for mental health check-ins using AI confirmed on the blockchain to receive benefits. I don't have them today, but I got my new set of clear protein from the Well Collective store. So I earned those through running nodes and through the G+ platform. And then I got these amazing new products that can help me to remain healthy. We're rewarding the right people. That's us. And then also we can restore data sovereignty. This helps to protect from some of these bad actors who have gone in and held ransom some of the health systems. And frankly, this is an in-between where you, and only you, when you have the power to actually have your own health data, that's when you can go connect to some of these new and ever-evolving AI tools. And last, decentralized apps. We know that within G+, we can allow you to share your information and your personal health data, your PhD, with anybody you like. You can take it with you across borders. You can take it with you wherever you're going, when you're going from health system A to health system B. And those are all very real solutions to the real world issues that we've just brought up. So there is hope. We are on the horizon for a better system, but it's up to us, and it's up to a decentralized community, just like Galvan and the Galvanators that are on this call, to make this better. So I end with this quote I really like. He's a great writer. He's a good surgeon. Dr. Atul Gawande, he said that our medical systems are broken, and we need much more than a new payment model or a new app. We need systems that care about the human being behind the disease. And I only know one way to do that, and that is to empower you as a decentralized community, because you care about yourselves and your health more than anybody. You care about those that you love who come into this community more than anybody. And this is just one more way that Galvan is galvanizing the world to heal humanity. So I hope this leaves you with hope and understanding about some of the shortcomings of the current system, but also ways that you can use the great tools and the blockchain that we've built in order to overcome those things and be your best self. So with that, I'm going to turn the time back over to Robert the Beloved to update you all on the next product development. So take it away, Robert.
Thank you. A pleasure. Interesting about healthcare systems. We're going to bring this down to a system of us. As Adam said, we are in charge of our own destiny here. So with Galvan Plus, let's talk about our own little healthcare system. Today, I'd like to just kind of show you a highlight of one of mine. So if you remember, when you look at your homepage, if you're on your homepage, the first thing that comes up is mood. You'll notice on that continuum there that I've got a little, I call it a bubble, a little blue bubble, which is my normal range, right? And you can see towards the smiley face there that I'm above the normal range. Now, uniquely, when I go into the details of that, and this, by clicking on it, it takes me right into our vitals page. This shows me, day, week, month, 6 month, year. But if you'll notice, my mood has been pretty consistent. The only challenge I've got is if you look, you see the last dot on the right, the second to the last dot on the right, and then there's a big space. What that tells me is that I did not do a wellness check on Sunday, and I missed a date there. And so that's what I kind of want to refer to today a little bit, of how we continue to motivate, inspire, and hopefully keep you on your wellness path. And so when I go back and I scroll down to the bottom, I have actually taken 3 of the streak badges and I've put them as favorites. Typically, if you don't do a favorite on your streak badge, then the ones that show on your homepage are the ones that you're closest to achieving. But you can see over here on the right, if I highlight that, it says the checkmate streak. And you can see by the progress bar, there's not much progress going on there. And so when I go into the details there, you can see now I'm only at 2 wellness checks, or 3%, because as I go to the details, I've earned the common, I've earned the uncommon, which are 2 levels of rarity that I can only earn once. And then I'm working towards my rare. And so now I'm only 3% because I missed my wellness check on Sunday. Then now I started over and I'm already at least 2 wellness checks towards that new goal. So uniquely, as I went back through, I've noticed that the times I've missed my wellness checks are Sundays. And so Sunday's a different day for me, and I don't have the regular process that I have the other days of the week. And so I've got to, in my healthcare system, aka me, I've got to determine a process by which I can be a little more dependent or a little more proactive on a Sunday. And so again, you can see at the top here, I have put a yellow star there and I've made it a favorite. So it sticks up right on my homepage. And so I can see that going as anytime. Now, another cool thing that most people aren't aware of, and I'm going to take you into this, is when you click on this little hamburger menu in the bottom right in that teal look, it pops that open. In the personal records, this is what's cool. So another thing to help motivate, inspire, is when I go into my personal records under mind and I click on wellness checks, we keep track of your streaks. We keep it in a little more of an intricate or detailed manner. So for instance, we keep track of what's your best streak just for mood. How many days, as I showed you earlier, when I'm in that normal bubble or better, how many days in a row has my mood been in that normal or better? And you can see on this one, it's 21. Stress, I do a little better, right? My streak is 23. Energy, my streak is 34. So energy seems to be my forte, if you will. And then how many days in a row have I had all 3 in the normal or better range? So far, mine is, it looks like from the 23rd of March through April 6th was my latest time to hit 15 days. So just another way to help you see how well you're doing and to give you another little challenge, if you will, on which one am I going to beat next. And so I wanted to refresh you on the personal records. Those happen with body and soul as well. But anyway, I just wanted to give you a touch on your own little health system, ways that you can continue to improve, inspire, and motivate yourselves to better conscious health. That is our tip of the day from the G Plus app. Thank you for joining. And with that, I will now turn it over to our inspiring customer service guru, Casey.
Perfect. Okay, so I'm actually going to kind of piggyback off of what Robert was talking about. I have an alarm set on my phone every night that goes off at 9:32 p.m. and it's labeled "Gotta beat Robert" because I'm extremely competitive and I am trying to get my rare badge before Robert can get his. So I'm going for 60 days. I haven't gotten it. I was ahead and then I missed today. And then he missed today. So he told me that this morning. So I got really excited and I'm back on track. So I have multiple alarms set up because there's the notification from G Plus. And then I set a separate alarm just in case I was busy and got distracted when the first one went off. The other thing I would like to point out is it's so easy to do the wellness check-in. It takes about 40 seconds and you just have to talk in your phone. It doesn't matter what you're talking about. You just need to do it. And it's going to check all of those different levels for you. It's going to analyze everything. I actually did mine while I was on this call. So there's my results. And shocker, I'm stressed. So we're going to work on lowering that. It did give me a power up, which I need to do those more because my stress normal range is still really high. So we're going to work on bringing that down. But I am just loving the badges and loving the kind of gamification and competitiveness that it can offer. So go get your badges and get your streaks and let's all go beat Robert. And I'm going to turn it back over to Byron.
Perfect. I love that segue. Let's all go beat Robert. That's awesome. So, hey, but that's what it's all about. I love when it's competition. It's competition on being what? More healthy. going out there doing those great things. So love the call, love that information. What Dr. Sharp shared was powerful stuff too. I mean, you think about that, you think about why there's a need for what we're doing and the things that are happening that way. You know, one of the things that I love is, I don't know if you've seen this or read this. I know I brought it up, but this is one of those things that I think more and more people, if you haven't read this, it's a great read, you know, Who Moved My Cheese? And I read this years and years ago as one of the business books when I was trying to kind of get started, or actually I'd been going, but just trying to learn and get better. And what I love about this is, if we think we're going back to the way things were done, guys, we're going to miss out. And the direction that we're going is the direction that we need to go for some of the reasons that, you know, Dr. Sharp talked about today, and for so many others. In fact, I went on ChatGPT and I just asked, you know, if we were going to set up, if I was going to set up, you know, a health and wellness blockchain, you know, what would it need to have? And it's fun. And this is kind of what it said and the benefits of it. It said it needed to have data ownership. Okay. All right. That's exactly what we're doing. It needs to incentivize wellness. That's exactly what we're doing. What is it? What we need to do, according to GPT, if we want to see, it needs to have transparency and trust in the services it offers. That's what we're doing here. And it needs to have a marketplace. We've got the Well Marketplace right now, and it needs to have innovation through research collaboration. I mean, when you start to hear some of the things that we're working on and things that are happening, this hits the mark every single point, and more of what we're doing. But if we don't see it, and I know we're here because we do, but if we don't see it, what our job is to help other people go out there and see this. To realize that the old way of doing things is the old way, and we can either get in front of it and be we have a chance right now to be a massive part of it, or we can get left behind and we'll just be, you know, absorbed into it, because everybody eventually is going to be. And I love the fact that we have the health and wellness blockchain. And for all of those node owners out there, do you realize that I want you to think of Ethereum as a blockchain, and all of the, like, you know, we can bridge what to ERC20s. We can do things on the Ethereum network, on the Ethereum blockchain per se, but there's all these layers. When you think of how many layers, and I know that this is forward thinking, but we're doing how many layers we can put on the Galvan blockchain that have to do with health and wellness, how many different things that we can do. Okay, more and more countries, more and more places are wanting that transparency and are demanding it, because consumers are demanding it. And the best way to get it is blockchain. Now, what's going to happen when it becomes a necessity for certain industries, or for, in certain countries, for people to make that transparency happen by a certain time frame? We're already seeing some of this stuff start to pop up in Europe and other places where they have until a certain time to be able to do this. Well, we have got the perfect scenario. On top of everything else that we're doing, we're going to be able to layer and layer and layer. And so I want you to think about this. We're creating this highway of information. We're creating this highway of health. And every single person right now, you have a chance to own a toll booth. A toll booth. Let's just think we're having this huge thing, this huge, you know, Autobahn, let's say, of information, and the toll booths are being built right now. And we're getting rewards right now from the nodes, but think of a node as that toll booth, that in the future, as that information goes through, those people that saw it, those people that get it right now, the cheapest time to ever get a node is now. It's $5,000 a node still. And, that's going to change here shortly. And we know what happens is more and more people are going to understand and see what we're doing. But things are changing, things are moving. So if we want things to change, if we want this month to be a better month than last month, then we have to change the equation. The results that we're getting today is an exact correlation to how we're spending our time and what we're doing. So I always love to do this at the beginning of every month. I want you to think of how many people did you share Galvin with last month? How many people? Was it 0? Well, what's your goal this month? How many people are you going to give tokens to? Because I'm telling you what, if you go out there and give people a free wallet and then tell them, hey, I want to give you some some Galvin tokens so you can see what's going on here as just a gift. That is such an amazing icebreaker. Okay. What I used to do in my previous company is, I was the CEO and owner of a international company of supplements, and we were in 43 plus countries. I got up to almost 47, 40, 50 plus if I count all the different business ventures I've been a part of. But here's the thing. It didn't matter what country we're talking about. If I could give somebody something to try, if I could give somebody a sample of a product or something to break the ice, then a majority of that awkwardness is already gone because I did something. I gave them something. We have an opportunity to be able to give everybody a free wallet that doesn't cost you anything, doesn't cost them anything. And we can give them some token and show them as a gift what this is, and that we want them to watch this as this project continues to go up or down. And you're going to see as this community grows, it's only going to grow. And so what I would do if I were you is I would say, how many people can you give a free wallet to this month? Because if you don't know what to do and you don't know what to say, that's an easy door opener. It's an easy way to say, hey, I've got something I'm really excited about. We're revolutionizing healthcare, and there's a wellness blockchain and there's a wellness token. All these things that are going on, we don't want to confuse them, but here's what I want to do. I want to give you some, because I'm excited about it. And the beautiful thing about that is once that conversation is started and open, then it's easier to have the other conversations. It's easier to follow up. It's easier to tell them more. So I think as a challenge this month, how many wallets are you going to give away? Because the wallet is going to create the opportunity for an introduction. And then once you've got that, you're going to find what best meets their needs. I always ask people a couple of questions. Hey, do you know anybody, or are you interested in becoming healthier and being able to track it? I mean, anything that's going to create curiosity. Do you know anybody who, or are you somebody who is interested in learning how to get rewarded for being healthy? I mean, there's so many simple questions that we can ask. And what we need to do is just ask those questions. And as we ask the questions, they're going to tell us what's important to them. We're not trying to sell them anything. We're trying to share. We're trying to serve. And like I was saying earlier in the call, that is going to be when success is attracted to you, because you're a builder, you're a giver, you're helping. You're trying to see what you can do to make their world a little bit better. And I'm telling you what, we have so many amazing, powerful options with what we're doing here at Galvin. The G Plus app, with teaming up with the Well Collective, with other collaborations that are continually coming. We have got something that nobody has. We're doing something in a way that nobody has done it. And so let's not forget that as we go out this month. Let's go out there and set goals. If we do not plan, there's no way we're going to see results. And that's the difference between an amateur and a professional in anything. The difference between an amateur and a professional is professionals track things. Professionals track it. How do you know where you're at if you don't know if you're getting better or worse? And this is all about personal development, because I know that we're all happier when we feel like we're progressing in something. I know that's if we feel like we're in a rut, if we feel down, if we feel discouraged. Like life is beating us all up. But something like this, a project like this, can give hope, because we're not talking about, blessing people's lives in your city, which that's where we start, but we're talking about the globe. We're talking about making a difference globally. And when we track something, we can see where we're at so we can get better. And when we're improving and getting better, I believe that's when we're the happiest. So I want you all to have a happy month this month. I want June to be a great month. because you're growing, because you're sharing, and because you're changing people's lives. You never know the impact that you could make in somebody, or somebody who was looking for something, somebody was hoping for something, somebody just needed something to believe in. And we have an opportunity to share this with them. So how many wallets are you going to give away this month? And here's what I love. You can go to CoinMarketCap and you can see how many wallets and how many holders of our token there are. I love that. You can see all of these different things. Actually, that's a Dex Screener. You can go and see that. Not CoinMarket, Dex Screener. And right now we're getting close to almost 9,000 people, according to them. I mean, I don't know if that's the 100% accurate number or not, but according to them, we're getting close to 9,000. I want to break that. So it's 9,000, 10,000. And the thing that I love about this and blockchain is you can't fake it. You can't hide it. You can see how many transactions are going on. You can see how many wallets there are. You can see all those things. So when people come and tell me about something, because I'm sure they try to tell you, try to hit you up on all this other stuff, we can validate what's really going on out there. Okay. So I want you to know that, I mean, if we already know, let's pretend we already know the end game. We already know this is the direction the world's going. We already know there has to be a health and wellness blockchain. It's one of the biggest categories there are out there. Why not us? Why can't it be us? Why can't it be you? Why can't you grab, a big piece of this community? You can. You're hearing about this. If we went on the street right now, let's say you go to your local Walmart or whatever it is, Target, and you stood outside that Target and you asked 100 people if they've heard of Galvan and they knew what we were, how many no's would you get? How many yeses would you get? How many people would say they'd heard Galvan when you went out there and talked to 100 people? You might get a couple of people to say yes, but they're just saying it because they don't want to act like they don't know. You would probably get close to 100 people that don't know who we are. And do you know what I call that? Opportunity. Because that's that opportunity that we have to go out there and be the ones that share, to be the ones that explain. And what do you think is going to happen when you have that first person come back and say, because of the G Plus app, this is what happened for my family member? Or because of the G Plus app, now I've got somebody in my family or myself is exercising and doing things that I otherwise wouldn't have done because I want to beat Robert, right? Or whatever that is, right? Think of that when that's going to happen. It's going to happen. Or that somebody takes their tokens and they go and use it in the marketplace and they get a product that can change their life. And the data that we're accumulating together is going to give us, using AI in the future, the ability to see things and change people's lives because we're out there doing this and building this community. I mean, when you start to really step back and think of the impact that we have a chance to be a part of, how do we not want to go out there and have June be our best month ever? How do we not want to go out there and share wallets with people and go and do all of those things? So let's set it right at the very beginning of the month. Let's do it. Let's take some time, commit to take some time and just, what are you going to do? How many wallets are you going to give away for free this month? How many people are you going to share things to? Or another way to open it up is how many people are you going to get to maybe try a product in the collective and let people know, hey, I can show you how to get this for free. I can show you how to earn this. Amazing stuff. So I'm just excited, if you can't tell, about where we're at, where we're going, and what's going to be taking place, because we're just going up from here. Okay. The cheese has moved. Okay, who moved my cheese? The old way of doing things is not coming back. It's like investing into Blockbuster right now. It's not coming back. Okay, what we want to be doing is we want to be investing in the future. Our time and energy needs to be in the future. So thank you so much for tuning in today. Thank you for being the Galvanators and being those trailblazers that go out there. I know I thank you a lot for this, but I know what it takes. I know it's not easy, but anything in life worth having, I don't know why, it has to be fought for. It has to be. And I know that everybody that makes that leap, those people that go out there and try to be a part of this, they're going to be grateful that they did and they were a part of it now as we're going out there and making things happen. So I want to thank you all once again. I want to thank the team. I want to thank Dr. Sharp, I want to thank Robert. I want to thank Casey for what they're doing, and everybody else behind the scenes that make things happen. And there's so many, but all of you out there doing things, you're making a difference. Let's go out and have an amazing month. And let's start by having an amazing day. The best way to go and change things is to do something and act now. Let's go act now. Let's go make it happen. And I'm Byron Belka, and I'm a Galvanator. Take care, everybody. We'll see you.